Sleeve gastrectomy is a mainly restrictive procedure. It works by reducing your stomach and controlling your hunger levels by appetite hormone. With minimal invasive surgery, we remove nearly 80% of your stomach and leave behind a small tubular channel, so you can eat a small amount of food and less calorie in one sitting. Also, we remove most of your stomach and your hunger hormones decrease, and you can control your appetite, so you give your kilos very easily. There is strict indication for sleeve gastrectomy that World Health Organization accept, and also in Turkey we obey the rules. You must be class 3 obesity. It means that your body mass index, which is calculated by your weight and height, is over 34 or 40, and you have some additional disease related to obesity. If you cover these rules, then you check your test, and you have to pass some health screening test, and you should be physically and mentally accept the operation and post-operative recovery period. And you need to do some exercise and diet before the operation, and you couldn't succeed, then you will be a good candidate for operation. Sleeve gastrectomy and other bariatric procedures are minimally invasive surgeries. They have similar complication rates like other common abdominal surgery, for example, gallbladder and hernia surgery. Because of minimal invasive surgery, the recovery period is fast, and we face minimal complication. In fact, the risk of obesity itself is more serious than operation. Yet some complications we can see, for example, bleeding from stapler line or leakage, or some thromboembolic disease we can face, but these are very low, less than 1%, and we can easily manage this complication if we face. Before the operation, usually I see and examine the patient, and we make some detailed tests before operation and some consultation, and we speak to patient about what procedure we should done, for example, sleeve gastrectomy or gastric bypass, because it's different for any patients. After that, we give some diet before the operation. We want patient to quit smoking if they smoke, and it's necessary to stop drinking alcohol before the operation for a good recovery. The day before operation, patient should not eat anything and drink it about 12 hours. The day of operation, we see the patient in his room or in his bed and speak one time more about his or her question. Then we do the operation. Recovery period of the sleeve gastrectomy is very easy. The day of operation, when he or she is awake, we mobilize them, and they stay in the hospital that day. Post-operative day one, we usually make some tests for leakage and bleeding, and if everything is all right, then we start liquid diet. And patients stay that day in hospital too. They usually stay 2 or 3 days in the hospital. And our dietitians see patients. Usually we don't face any problems, and we increase their mobility and their diet. And then we prescribe some medicine and speak to them everything about post-operative recovery and send them to the hotel. Usually in our hospital, we see patient 2 or 3 days after operation and check them again. If there is a problem, we take action about that. After that, we give them a list of exercise and diet, and we can send our patient to their country. Generally, our patient need to stay in our country about 1 week on 10 days because preoperative period takes 2 days. We usually hospitalize them for 2 or 3 days, and 3 or 2 days we want to see in polyclinic control, so they need to stay 7 or 10 days in Turkey, but their full recovery will be 1 month in their country.